Kermit Gosnell, a name that has become synonymous with horror and ethical violation in the medical community, was a physician whose practices have left an indelible mark on America's perception of abortion clinics and regulatory oversight. The saga of Kermit Gosnell's career is a complex and troubling tale that combines illegal medical practices, gross negligence, and systemic failures that allowed his actions to continue unchecked for decades. Kermit Baron Gosnell was born on February 9, 1941, in Philadelphia, Pennsylvania. Raised in a religious and middle-class African-American family, Gosnell showed early promise and academic success. He attended the prestigious Central High School in Philadelphia and later graduated from Dickinson College with a degree in biology. Gosnell pursued his medical degree at Thomas Jefferson University, earning his MD in 1966. In the 1970s, Gosnell became involved in the emerging field of reproductive health and abortion services. He initially worked in a clinic in New York before returning to Philadelphia, where he opened the Women's Medical Society in 1979. Positioned in the lower-income neighborhood of West Philadelphia, Gosnell's clinic was ostensibly a facility providing much-needed reproductive health services to disadvantaged women. Over the years, the Women's Medical Society became the subject of numerous complaints and investigations, though many of these were mysteriously dismissed or ignored. It was only in 2010, after a federal investigation into illegal prescription drug distribution, that the true extent of Gosnell's malpractice was exposed. Gosnell's clinic was found to be a house of horrors. Investigators uncovered a facility in a state of filth and disrepair, with blood-stained furniture, unsterilized instruments, and fetal remains stored in jars and freezers. Patients were subjected to unsanitary conditions, and Gosnell's staff included untrained and unlicensed individuals who administered anesthesia and performed medical procedures. The most egregious of Gosnell's crimes were the illegal late-term abortions and infanticide. Pennsylvania law prohibits abortions after 24 weeks of pregnancy, but Gosnell routinely performed them well beyond this limit. He used the method of inducing labor and then snipping the spinal cords of viable babies born alive, a practice he referred to as ensuring fetal demise. The grand jury report detailed numerous instances of infants born alive who were then killed by Gosnell and his staff. The report described one baby who was estimated to be nearly 30 weeks gestational age and alive for 20 minutes before Gosnell severed its spinal cord. In January 2011, Kermit Gosnell was arrested and charged with 8 counts of murder, including 7 infants and 1 woman, Karnamaya Mongar, who died from an overdose of anesthesia administered by untrained staff. The charges also included numerous counts of illegal late-term abortions, conspiracy, and drug distribution. The trial began in March 2013, and the prosecution presented a harrowing case with testimonies from former clinic employees, patients, and medical experts. The defense argued that there was no conclusive evidence that the infants were born alive, and that Gosnell was a scapegoat due to the controversial nature of his work. On May 13, 2013, Gosnell was found guilty of 3 counts of first-degree murder for the deaths of the infants, involuntary manslaughter for Mongar's death, and numerous other charges. He was sentenced to life in prison without the possibility of parole. The Gosnell case had far-reaching implications for abortion politics, regulatory oversight, and public health. It exposed significant failures in the regulatory system, highlighting how complaints and inspections were ignored or inadequately addressed over decades. This led to calls for stricter enforcement of existing regulations and the implementation of new policies to ensure better oversight of abortion clinics. The case also intensified the debate over abortion in the United States, with pro-life advocates using it to argue for more stringent restrictions and pro-choice advocates emphasizing the need for safe, legal, and accessible abortion services to prevent women from seeking unsafe alternatives. Kermit Gosnell's case is a grim reminder of the potential consequences of regulatory neglect and the importance of ethical standards in medical practice. It underscores the need for vigilance in protecting patients' rights and ensuring safe medical environments. While Gosnell will spend the rest of his life behind bars, the lessons learned from his actions continue to shape discussions on medical ethics, reproductive rights, and regulatory reforms.